Let's say that you're in your car. You're driving on 166, kind of going out towards Nukuyama. Down the road, you see some headlights that are kind of pointed towards you. That's not exactly where it's supposed to be. You try to kind of maneuver out of the way, but it's coming very, very quick. And then, unfortunately, this happens. You black out. When you wake to darkness, the smell of automotive fluids, and noise. It's hard to breathe because the dashboard is pressing up against your chest. Ambulance gets on scene, and the biggest thing at this point is they need to get you out. You hear commotion everywhere. You hear the scraping and the grinding of all the tools that the firefighters are using to cut apart this car and get you out. By the time they're able to get entry, they put a collar around your neck to make sure that nothing neurological happens. They take you out on a backboard, they place you in the ambulance, and they drive lights and sirens going to the hospital. Where you get to the hospital, you go through emergency surgery. You spend a long, painful recovery at the hospital, and then 6 to 8 months in long-term care learning to walk again. This is a real patient from 2022. This is one of our data metrics that's in here. So please consider when doing this data, these are all patients that have been severely affected for the rest of their lives, and that's why this road to zero is so important.
Road to zero, roadway fatalities and serious injury safety target.
The safety target of zero fatalities and serious injuries by 2050 is based on the fact that traffic fatalities and serious injuries are preventable.
Everyone shares the responsibility for road safety, including education.
We have had educational programs in South County for most of the time that the organization has been created.
Last year, I was here at this forum, and I learned about complete streets and the safe system approach.
You really need to communicate where the problems are, what's the source of the problems.
Enforcement.
So we're working hard to try and make sure that we are being that in-view patrol.
Legislation.
We held a town hall, and we had presentations from Caltrans and CHP, from TAMC. It was well attended.
When I took office in 2017, I immediately convened a group to start looking not only at the 154, the state highway, but 101 and the 246.
Infrastructure improvements.
Fix it first. That's a huge part of our program, and what we're trying to do is keep what we have working and keep it in good condition, as good condition as we can.
And technology advancements.
You can have really poor infrastructure characteristics, that a bad accident is just waiting to happen, but it hasn't happened yet. But there's a lot of near misses, and that data is so valuable. And I can tell you, data collection firms that we hire are starting to come up with ways to automate that.
SLOCOG recognizes there are numerous fatal and serious life-altering injuries annually on our region's public roads.
I was hit by an uninsured, distracted driver while I was riding to meet friends for a workout. After 2 years of surgeries, a bone infection, I'm still a cyclist, just with a prosthetic leg and fused lumbar vertebrae. All 4 of mine are fused.
100% of the pressure from that collision goes directly into your body. There is no crumple zones. There is no shock absorbers. And most of the time, there's death before we even arrive.
Traffic safety is a social equity issue.
Communities of color are overrepresented when it comes to fatalities at the state level.
This is not just about road safety as much as it's about road safety for everyone, the motorists, the bicyclists, the pedestrians.
Fatal and serious crashes are not inevitable, and death and severe injury are not an acceptable cost for using our public roadway system.
During this time period of 2019, the year to date, there's been 217 accidents in 2.4 miles of roadway. When I talk about the 2.4 miles, it's from the Highway 101 underpass to Airport Road. You can see from the Monterey County line all the way south to Atascadero. The highest fatality rating is 2.4 miles on Highway 46 in Paso Robles. So the city wants to do something about it. And really what we're proposing is, instead of having the Airport Road and the Union Road just go out onto the highway, we would rather get stoplights or something to prevent the fatalities, the serious injuries That's not an option for us. The only option is an overpass. We need to find a way to prioritize the danger in our highways and the safety improvements that we need to move forward. And that's really how John and I connected, is how can we prioritize these areas in here for funding? How do we get support from the state to help us? We don't have $110 million to solve a problem that's coming from I-5 in the Central Valley into the city of Paso Robles.
We need to be very serious and action-driven to do the things that will help this county become an outstanding example of a safe and supportive community.
We hope to see people working together and less working in silos. That walk audit that was earlier today was amazing in the sense that we had representation, or you guys had representation from all, from Caltrans, from local residents. That's the way to move the project forward.
And I know you all here are very valuable in making that happen, so appreciate you spending the evening here tonight.